I first heard about Dr. Mehmet Oz the way a lot of people did, when he first started appearing on The Oprah Winfrey Show in the mid-2000s.
Today, Dr. Oz is here to help us get healthy and literally peel off the years with the ultimate, the Mac Daddy of anti-aging checklists. Dr. Oz, my Mac Daddy.
We got a lot of goodies.
Oz was a successful heart surgeon who became a television lifestyle guru with a healthcare empire worth tens of millions of dollars.
I'm telling everybody right now, get out your pencils and paper. It's a lot of information.
On Oprah, and then on his own show, The Dr. Oz Show, he promoted various diets, supplements, and regimens that he said would make people healthier fast.
Today, big news. I'm announcing my biggest weight loss program to date. It's been a year in the making. The Total 10 Rapid Weight Loss Plan. And we can rev up your metabolism forever. All I'm asking for is 1 week. It's my 7-day miracle plan to boost your metabolism. Today is all about miracles, revolutionary items, big and small, that could change your life.
His claims on that show, including the segments on possible weight loss regimens and dietary supplements, were frequently panned by public health experts and fellow physicians.
Lauren Weber is a national health reporter for The Post.
So what does it mean to have someone who for years has profited from pushing these unproven medical treatments now run two of the largest health insurance programs in the United States?
Lauren is referring to Dr. Oz's latest career pivot. President Donald Trump has chosen him to lead the Centers for Medicare and Medicaid Services, also known as CMS. It's the agency that runs Medicare and Medicaid, the federal programs that provide health insurance for seniors and people from low-income backgrounds. Oz's confirmation hearing in the Senate is scheduled for Friday, and if confirmed, Oz would be in charge of programs that cover over 100 million Americans.
Oz would be taking over two programs that are potentially facing massive cuts in the cuts to federal spending. And he's doing so with a background of, unproven health claims. He, for years, has blended the boundaries, critics say, between science and what's proven and what he's promoting. And it remains to be seen, obviously, how that will play out as he takes over leading two of the healthcare programs that millions of Americans rely on.
From the newsroom of The Washington Post, this is Post Reports. I'm Colby Ickowitz. It's Thursday, March 13th. Today, ahead of his confirmation hearing, we look into Dr. Oz. Doctor, TV personality, businessman, and politician. We talk with Lauren about why Donald Trump nominated Oz, how Oz might approach his work at the agency, and how he is working to divest himself from a web of possible conflicts of interest. So, Lauren, for people who didn't watch Dr. Oz on The Oprah Show or on his show, who is he? Who is Dr. Oz?
So Dr. Mehmet Oz is 64 years old. He's a Turkish-American who was raised in Delaware and got his start as a very, 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 very successful cardiothoracic surgeon. He was a professor at Columbia in New York, and then he kind of makes this shift into TV, really supercharged by Oprah.
Dr. Mehmet Oz is back, and he claims, this is what he says, he has the real weapon against fat. Don't we want to know what that is?
And ends up starring in his own daytime TV show in 2009 that's syndicated through Sony Pictures Television and ran for 13 seasons.
Today on The Dr. Oz Show, bust your fat forever. 5 newest, fastest fat busters.
In many ways, it's the Holy Grail.
And that's where some health critics started to have an issue with Dr. Oz. They complained that a lot of what he was promoting was unproven, that he was pushing supplements and cures for weight loss and other issues that didn't have the science to really back up some of the claims he as a physician was making. And there's literally papers written about the quote-unquote Oz effect, which is what happens when he would promote a product on a show. Usually sales would go up, news articles would be written about it, hype around that product would continue. And I mean, really, Dr. Oz is fascinating because he rose to prominence before social media as we know it. But, there is a version where he's kind of like a wellness influencer before social media took off. I mean, he was hauled in front of Congress in a pretty aggressive hearing in 2014.
Thank you to members of the committee for convening this session, this hearing, and for allowing me to testify. Consumer scams and fraud related to weight loss products have played...
So this was a hearing looking at some of Oz's advertising, including some of it that was about weight loss products. And during this hearing, Oz had a pretty heated back and forth with former Missouri Senator Claire McCaskill, who's a Democrat.
Why would you say that something is a miracle in a bottle?
My job, I feel, on the show is to be a cheerleader for the audience. And when they don't think they have hope, when they don't think they can make it happen,
McCaskill said, she was someone who'd struggle with weight gain her entire life, and that people like Oz that promised these miracle cures really preyed upon people like herself that were struggling with their weight.
Passion in connection with the word miracle, pill, and weight loss is a recipe for disaster in this environment in terms of the people who are looking for an easy fix.
Around that time, he apologized. He promised to cut back on his show on overstating medical promises. He even went on to say that his TV show was, quote, not a medical show. He also made a point of saying that he was trying to work on things that he would say to his family members. He was trying to appeal in his own Ozian kind of way to the audience and at home. And it's a fascinating endeavor, and it's quite fascinating to realize that now, a little over a decade later, he could be confirmed at the Senate that once confronted him.
And after that hearing, did he continue to promote these alternative treatments on his show?
He initially vowed to kind of cut back on some of that, to say he was going to substantiate it with more science. But critics say that after a couple years went by, that promise did not hold. And eventually, he stopped his show when he started running for Senate in 2022 in Pennsylvania.
Pennsylvania needs a conservative who will put America first, one who can reignite our divine spark, bravely fight for freedom, and tell it like it is. That's why I'm running for Senate.
Yeah, Lauren, it's funny. I actually helped cover his campaign for the Senate for the Post. I went to a bunch of his rallies in Pennsylvania, and I'm remembering now, he had such a big TV personality at the rallies, but he was very much viewed as an outsider in the state.
Yeah, Donald Trump even endorsed him, but Oz ended up losing. Fast forward to today, and he's moved his TV personality online and gotten even deeper into the supplement space.
Dementia touches every family, including mine.
So one thing that really stood out to myself and my colleagues when reviewing his social media was in 2024, he promoted a supplement that he said his mother used to fight off dementia, which is a very personal example.
They come from fish oil, or you can get it from algal oil supplements as well. Now that, my friends, is using and protecting your brain.
How has he responded to criticisms that he has been hawking these unscientific treatments?
So his previous responses to us, did not really directly address criticism that he promoted products that were not scientifically proven to work. A past spokesman told us that, quote, as a world-renowned cardiothoracic surgeon who led the Heart Institute in New York Presbyterian Medical Center, Dr. Mehmet Oz is eminently qualified to help make America healthy again. Dr. Oz's knowledge and success in healthcare, innovation, and communications will be an invaluable asset to the American people and the Trump-Vance administration, and he appreciates the opportunity President Trump has given him to lead CMS.
Let's back up and talk about the Centers for Medicare and Medicaid Services for a second. What is this agency and kind of what's at stake here? What exactly would Oz be responsible for if he is confirmed to run this agency?
Dr. Oz has been tapped to run the Centers for Medicare and Medicaid Services, which is also known as CMS. So this health agency covers healthcare for millions of people. Medicare obviously is the federal health insurance program for Americans who are 65 and up. And then Medicaid is a federal state health insurance program that covers folks from lower income backgrounds. And, Oz would be overseeing the health insurance coverage for nearly 40% of all Americans between these two programs, with a budget of over $1 trillion annually. That involves really digging into the regulations, whether that be around the Affordable Care Act or regulating the Children's Health Insurance Program. It involves a lot of complicated health insurance and pieces of American health care that touch many, many, many Americans' lives. It's a major responsibility, and it's honestly, especially in this era that we're seeing where Republicans, Donald Trump, and the DOGE efforts led by Elon Musk are looking to cut funds, Medicaid and Medicare could part of their services could be on the chopping block because that's a ton of the federal budget that they make up.
I mean, I thought about this when he was running for the Senate. Like, this is a man who has a successful television show. He's a celebrity. He's very wealthy. Like, why would he want this position? Like, why would he want to do this job, which is going to be a pretty hard job?
That's a great question. I mean, Oz's financial ethics disclosures show that he's worth most likely in the hundreds of millions of dollars, with him and his wife's assets coming in somewhere between $95 million and $340 million. I know a lot of people that if they had that much money would probably not want to spend their time dealing with the massive, sprawling bureaucracy. But this is something that Oz has said he's been honored to be chosen for and is excited to do if confirmed.
After the break, untangling Dr. Oz's possible conflicts of interest. We'll be right back. Why do you think Trump has picked Dr. Oz to run this massive agency?
Well, it's no secret that Donald Trump likes people that have been on TV. Dr. Oz literally had a TV show, so that helps a lot. But as many of his proponents say, Dr. Oz has an MBA and is a physician, so he has some management experience in that regard, a lot of the folks that are for him say. And Trump himself said that Dr. Oz will be, quote, a leader in incentivizing disease prevention. And previously, Trump had appointed Oz to the President's Council on Sports, Fitness, and Nutrition.
I also remember when Trump was running for president in 2016 the first time, he actually went on Dr. Oz's show, and they talked about Trump's health. I think it was at a time that Trump wasn't going to release his full medical records.
If a patient of mine had these records, I'd be really happy, and I'd send them on their way.
That's good.
I must say, I would have shared this earlier. Why didn't you blast this out?
I didn't think it was necessary.
So they have a relationship that dates back like many years. So maybe it's not that surprising that he would then choose him to run this agency. But what was like the outside reaction to this nomination?
I mean, Republicans were excited. They said, look, he's got a medical and business degree from Penn. He was a professor at Columbia. He knows healthcare. We've seen him on our TV talk about healthcare for years. Whereas Democrats were mad. They felt like he was unqualified. They pointed to a lot of potential conflicts of interest he has with many of his healthcare businesses and investments and positions.
We need an alphabet soup of 13 vitamins. We got A through E, and then vitamin K. They power our
So
organs.
there's this fascinating example that right after Oz was nominated, it was right around Thanksgiving time, he hopped on his social media channels, TikTok, Instagram, and promoted this supplement for stress, which is sold by the company iHerb.
So splitting the dose ensures there's a steady supply of these nutrients in your body all day long.
What's interesting about iHerb is that a watchdog group came out with a letter saying that Oz was not properly disclosing how he was invested in this company as he was promoting it. Since this time, he has disclosed to the Office of Government Ethics that he's planning on divesting from some of his positions in companies like iHerb, as well as giving up different standings. But, the episode speaks to how Oz operates in this really interesting influencer healthcare economy.
Are there any other examples of potential conflicts of interest?
Yeah, my colleague Desmond Butler and Caitlin Gilbert and I uncovered that Oz had also extolled Ozempic and still is extolling as of today on his website, Ozempic.
And remind us what Ozempic is. I think a lot of people know, but for those who don't.
Yeah, it's a weight loss drug. But back in 2019, it was being marketed as a diabetes drug.
He's opening up about his type 2 diabetes diagnosis. Here on behalf of my trusted partner, Novo Nordisk, please welcome Billy Gardell.
The comedian Billy Gardell also had shed 21 pounds after 5 months on the medication. So Oz, when he was kind of promoting this as a bit of an infomercial embedded in his daytime talk show, that that raised some questions among some of the experts that my colleagues and I spoke to, because that infomercial was sponsored by the drug's manufacturer, who Oz referred to as a trusted partner. That's one of the earliest instances of him promoting this weight loss drug, which kind of showcases the financial ties between him and the companies whose fortunes he would have a hand in as CMS head. So Novo Nordisk told us that while the company worked with Oz's show to sponsor the paid advertising segment with Gardell in 2019, it does not have an ongoing relationship with Oz.
Yeah, it made me wonder, does Medicare and Medicaid cover Ozempic?
So Medicaid and Medicare currently cover some weight loss drugs in limited instances, but they have not expanded the use of those weight loss drugs because it would be really, really, really expensive.
What else do we know about Oz's general stance on Medicare and how he might run that program?
So Oz has pushed to privatize Medicare. He wants to expand Medicare Advantage, which is an offshoot of traditional Medicare that allows older Americans to enroll in health plans that are provided by private health insurers. About 33 million Americans are currently covered under Medicare Advantage, which is slightly more than the number covered by traditional Medicare. But what critics and many Democrats have said about this is a problem is that Oz at the time, and as his financial disclosures recently revealed, owned up to potentially $600,000 in United Health Group stocks. And United Health Group obviously owns United Healthcare. And so their concern and their complaint is that he would benefit at the time from the further growth of Medicare Advantage. Now, Oz has promised to give up those stocks if confirmed. And, there's a lot of conversation right now in general over the benefits of Medicare Advantage versus traditional Medicare. So conservatives have championed the expansion of Medicare Advantage. They say it offers more benefits. But Democrats and patient advocates often argue that private insurers are excessively billing the federal government while also denying treatment to patients.
So now, Lauren, knowing all of this, what are you going to be looking for on Friday when Oz has his confirmation hearing in the Senate? What will you be watching for in the senators' questions and also in Oz's answers?
So I'll be curious to see actually how much pushback there is. I mean, as we've watched over the last couple of months, as Trump's nominees have gone before the Senate, all of the ones that have gone before the Senate have been confirmed. The two that have not had their nominations withdrawn before they made it to their Senate hearing, and that was Matt Gaetz, Trump's pick for Attorney General, and just, today, Dave Weldon, who was Trump's nominee to head the Centers for Disease Control and Prevention. But other than that, it's been mostly smooth sailing for Trump nominees. So it's pretty widely expected that Oz will be confirmed without much pushback, but I'm curious to see what Dems will ask him about. I think a large amount of the questions could focus on Oz's finances, on his connections with Medicare Advantage, on some of these claims around unproven supplements and what he did to promote them. But it all remains to be seen tomorrow.
Lauren, thank you so much.
Thank you so much for having me.
Lauren Weber is a national health reporter for The Post. That's it for Post Reports. Thanks for listening. Today's show was produced by Alana Gordon. It was mixed by Sam Baer and edited by Peter Bresnan with help from Maggie Penman. Thanks to Lynn Bowie, Drea Cornejo, and Caitlin Gilbert. I'm Colby Ekowitz. We'll be back tomorrow with more stories from The Washington Post.